undo the lid on the PAP thing. Because when you're in here and then you go to like put it in there and the plastic's still around it and the lid's still on, it's like super awkward and you get really frazzled. So I always take the plastic off and I loosen the lid but put the lid back on, just really loose so that I can just with one hand unscrew it and put it to the side. And
because that's sterile in that.
In there, yeah. Not really because you put the brush in that's not sterile, but yes.
But until then.
Yes. Okay, so then I'll say, all right, I'm gonna have you scoot your bottom here. All right, and so usually on an exam, I'll have them scoot over, and if they don't need to be that far over when I do the exam, you can push them back, but oftentimes, like I said, the cervix is posterior, and so the further you have their butt off the table, it helps to draw that cervix into a more neutral position.
Oh, okay.
So another thing you can do is have them put their hands underneath their butt or hips here, and that'll also kind of simulate that same position, and you could put a pillow under there as well. So those are all things. The easiest one to do is just have them scoot almost like off the table, and then you can get it into view. So you got you scooted down here. All right, now I'm gonna put this foot in this stirrup here, and this foot in this stirrup here. All right. So I'm gonna lift the drape now and uncover you, and I'm just looking at the outside here. You're gonna feel my hand on your inner thigh, and I'm gonna feel your lymph nodes. You tell me if you have any tenderness. Same thing on the other side. Any tenderness? No, that's great. Now I'm just looking on the outside of your vagina here, and I want to have you, and so right here, you grab the labia minora too. Open that up. Usually I do one hand. This is plastic, it's a little bit harder, but my non-dominant hand, I'm going like this, so then I can see the clitoris, the urethra, and then any bulging in the vagina here. I'm gonna have you cough for me. All right, so I don't see any bulging, so that's good. I'm going to just palpate for any masses or lumps or lesions here, both sides. Any pain with that? I know it's uncomfortable, but any pain? Okay, good. So when we're looking here, I'm visualizing the hair distribution. I'm looking for any erythema, any redness, any sores, any evidence of itching or scratching, any nits if they do have pubic hair. And then we're also looking at condition of clitoris, if there's a piercing or not. And then at this point too, we're also visualizing the anus and rectal area as well. Is there any scarring? Like, did they have a tear with any of their pregnancies or deliveries? And then any hernias or, not hernias, excuse me, hemorrhoids in this area too, because you can note that like it looks like a skin tag, so that would be like a non-inflamed hemorrhoid. If it's big, bright red, bulging tender, that's an inflamed hemorrhoid. So if you saw something like that, you could say, oh, do you have hemorrhoids that flare every once in a while? Yeah, I do. So then you're also assessing that, and you're letting the person watching you know that you're looking at that area as well. Okay, so we're gonna do the PAP now. So I'm going to insert the speculum. This is going to be uncomfortable, but it should never be painful. If you need me to stop at any time, just say stop. All right, so here's where I go to the sink and I turn the water on, and I just run warm water over the speculum to warm it up so that it's not cold. Even plastic ones are kind of cold, so you still adds lubrication that doesn't interfere with our PAP cold sample that we're collecting. And it also warms it up so it's not shocking for the patient. So warmed that up. All right, you're gonna feel my hand here and here. And we're just going to insert the speculum. These hard plastic models, sorry. Don't normally have to struggle that much. And now this hand stays here, because now you've got the labia separated here, so now you're ready to insert the speculum. So this is what I was talking about. You don't want to go at a 90-degree angle, because if you did that on a real person, this skin is all, collapsed here. You're going to rub right against that urethra, and that's pretty painful and uncomfortable. And so this is where you kind of go at like a 45 until you've got it inserted right in the introitus there. And then you're going to level it down and face downward. And when I say downward, I mean downward. And notice my hand here is holding those blades together, because if I went in like this, that blade could catch on some skin and it can open up and jab, and that's pretty painful too. So you want this in the low position here, and you wanna make sure you have the blades secure. I have my thumb under here. All right, you feel some pressure here. Now just breathe through your nose and wiggle your toes for me. Wiggle those toes. Wiggle, 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 wiggle. Turn my light on. Good job. Keep wiggling those toes. So now you see here, I can see with this clear speculum that I'm underneath the cervix there. So now what I can do is I can pull backwards just a tiny bit. Now I'm gonna switch my hands, and this is where I don't want the click. So you're gonna push up on that thing right there, and that way you can open this silently, and you kind of do a sweep until it's in position and around the cervix. Right there. So now I can visualize the cervical os, which is slit. Cervix is pink, non-reddened. Vaginal walls are clear, and discharge is milky white to clear. I'm gonna collect the sample now, okay? You're gonna feel some pressure here. 1, 2, 3, 4, 5. The pap brushes are a lot easier to turn because they have those grooves. This gets stuck on your gloves. So you did the 5. So now this really isn't going anywhere, so I can leave it like that. Now I've already loosened my lid. I pop that off. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Put that to the side, put the lid on. Going back over here. All right, we're gonna take out the speculum. So now I'm pushing up on this, releasing the blades, and allowing it to kind of naturally close. And you can see I'm starting to tilt this as I start to pull it out. Right there, and it's closed all the way naturally. Speculum's removed. Put that off to the side. All right, so now if you're gonna move to a bimanual exam because they're thin and you wanna practice that, otherwise remember it's not really indicated anymore, or if they're symptomatic. Lower abdominal pain, fever, or pain with intercourse, those would be reasons that you'd wanna do a bimanual. So now I'm gonna do a bimanual exam, and I'm gonna ask you if you have any pain with what I'm doing. So you're gonna feel my hand again, here and here, okay? And so I insert sometimes just one finger initially, and then insert the second. And this is my non-dominant hand here, and I'm palpating with my dominant hand. So I'm pressing up on the cervix. Any pain with that? No? Okay, I know it's uncomfortable, but any pain? All right. So I'm pressing up. So now I'm going to feel for the top of the uterus while I'm pressing up and behind on the cervix and the uterus there, and I'm pressing downward, and I'm just kind of like milking my hands to, oh, this is a nice, easy uterus to feel. So you're feeling for firmness. It's not boggy. It doesn't feel excessively heavy or full like it would be if you had someone that had fibroids or something like that. So any pain with that? No, good. So I'm gonna move on to the side here. First, you're gonna feel me put pressure on the inside. Any pain? Nope. Now I'm gonna relax fingers on the inside and just press on the outside. Any pain with that? Nope, good. And then together, any pain with that? Great. Same thing on the other side. Any pain here? No. Pain here? No. And now together. Excellent. All right. I don't feel anything abnormal. I don't feel any masses or anything to be worried about or concerned about. And you're done. All right, go ahead and scoot back and sit up.